Prepare to have your health questions answered here on Safe, Effective Natural Solutions with Dr. Todd Binkley, owner of Binkley Healing Center in downtown Ventura. Now, here's Dr. Todd.
Good afternoon. I am Dr. Todd Binkley, non-force chiropractor and practitioner of functional medicine. Functional medicine means using diagnostic tests to identify places where normal health, normal function, the normal function of your kidney, your liver, your immune system, and other parts of your body is no longer working the way it should be. Instead of just waiting until you need medical care to treat disease that you already have, perhaps even in an advanced state, before you know it. And one of the most common things that people come to me for is fatigue, unexplained exhaustion, lack of energy for no apparent reason. And there is always a way to improve your energy. Things always show up on tests. It's never one thing. In my experience, I'm going to talk about a really great case of a woman who was just having really debilitating fatigue, had been to several other doctors, no one could help her, and we've got her feeling a whole lot better. But before I do that, I'm going to go over some of the latest updates in the medical literature. This one's really exciting. The headline is Cholesterol Denialism. Is it pseudoscience or appropriate medical care? So there's this controversy that's been going on where someone wrote into a major medical journal saying that it's ridiculous, people who say that everyone shouldn't be on statin drugs. Statin drugs are the most common cholesterol-lowering drugs like Lipitor, atorvastatin, Zocor, simvastatin. And many in the medical profession, if you go by how they practice, just basically think almost everyone should be taking these drugs to, in theory, prevent heart disease. And there's a increasingly a growing and vocal minority in the medical profession, and especially natural health community, that suggests that no, not everybody needs to be on statins. Even people that are at risk of heart disease, there are better alternatives, and it doesn't make sense to put everyone on statins. So, of course, somebody wrote an article saying this is ridiculous, everyone should be on statin drugs. That's an abbreviation of the first article. So this latest article is written by two doctors who happen to have a different opinion. So John Abramson, MD, retired family physician who was an expert in pharmaceutical litigation, and Dr. Robert Kaplan, PhD, who's a researcher and an expert in clinical research standards. And they begin by agreeing with the cardiologist that wrote the original article that for some people at high risk who've had heart attacks or strokes before, that statins are beneficial. There is some research to support that. But they go on to point out that people who are not at high risk for heart disease, who take statin drugs, the benefit is modest at best. And they cite data from the National Health and Nutrition Examination Survey that shows that nearly 2/3 of people who are using statins are not at high risk. And they cite the 2022 Systematic Review and Meta-Analysis. This is when a bunch of studies are aggregated to see if there's a trend, that was done by the U.S. Preventative Services Task Force that included 12 studies on statin therapy for primary prevention of cardiovascular disease. None demonstrated a statistically significant reduction in cardiovascular mortality. Point out how these findings are consistent with several other investigations, including the internationally respected nonprofit Cochrane Library's publication in 2011 of a systematic review that concluded, quote, only limited evidence showed that primary prevention with statins may be cost-effective and improve patient quality of life. And caution should be taken in prescribing statins for primary prevention among people at low cardiovascular risk. So even among cardiologists and mainstream medical professionals, there is a lot of disagreement on who and how many people and how early and how often and how much statin drugs people should take to attempt to reduce their risk of cardiovascular disease. So why is that? Well, in 1994, a cholesterol treatment trial collaboration was established with the goal of aggregating the data across all these major trials to add more information about subgroups like women and the elderly and increase the potential relevancy, clinical relevancy of the data by pooling, which is similar to the pooled trials that I was talking about just a minute ago, but even on a grander scale. Well, here's the rub. They agreed to pool all these data, but the investigators in the studies, all but one of which were funded by pharmaceutical makers, provided confidential individual level trial data, but there was a catch. Before receiving the data, this group agreed that it would be held in strict confidence and would not be used in any publication, quote, without the permission of the responsible trialists. In practical terms, that means that nobody outside this group would be given the opportunity to verify and replicate the results. So in the age of open science, peer reviewers, guideline writers, and independent analysts have been denied access to the data that might resolve these differences of opinion. They close with this. The preferences of those who choose to reject statin therapy must be respected. Doctors who engage in high-quality, informed, shared decision-making are delivering optimal patient care. So those are the words of Dr. John Abramson, MD and Master of Science, practiced as a family doctor for 22 years and served on the faculty of Harvard Medical School for 25 years. And as an unpaid consultant to the Department of Justice and the FBI, he's written 2 books about the commercial takeover of knowledge doctors must rely on, the most recent of which is Sickening: How Big Pharma Broke American Medicine and How We Can Repair It. And the other author of the data I've been talking about today is Robert Kaplan, Ph.D., who's a senior scholar at Stanford University's Clinical Excellence Research Center and a former associate director of the National Institutes of Health. So in spite of all that, most medical doctors are going to continue to tell most of their patients that they should be taking statin drugs, and there's lots of reasons for that. Not all of them good. The main point for you is there's better ways to reduce your cholesterol, but even more importantly, reduce your risk of heart disease, because those two aren't the same thing. I've listened to my other podcasts about heart disease. Cholesterol doesn't cause heart disease. Inflammation causes heart disease. Cholesterol is part of the process of dealing with the inflammation in your blood vessels that leads to the formation of plaques that cause heart attacks and strokes. And there's other ways to prevent that, even without lowering your cholesterol. So email me if you have questions about that. With a single product called Bergamot BPF, my orthomolecular products, I've routinely seen people lower their total and their bad LDL cholesterol by 25, 30 points. I've had a few patients that have reduced it by 40 or 50 points, one even up to 70 points. By taking that product and eating a decent diet and getting a little bit of exercise. So it's important, number one, to know that there are real alternatives to preventing heart disease and lowering your cholesterol, but also statins cause real harms. The way statin drugs work is by putting a chemical clamp on your liver, and in the process, that same HMOQ reductase enzyme pathway that's blocked in the liver produces the production of coenzyme Q10, which is coenzyme Q10 is the most important enzyme for healing and repairing heart muscle and muscle throughout your body. That's why one of the main side effects, if not the main side effect of statin cholesterol lowering drugs is muscle aches and pains. Well, you can do a blood test to see if it's also suppressing the production of adequate amounts of coenzyme Q10. CoQ10 is the main enzyme you need to heal and repair heart muscle. So all these doctors are giving people the cholesterol-lowering statin drugs to prevent heart disease, and at the same time impairing the production of the natural enzyme your body makes to keep your heart healthy and strong, CoQ10. So you can test that with a blood test that directly measures CoQ10 in your blood, or more importantly, a test called BNP. I've talked about this test a lot on my previous shows before. BNP, Bob, Nancy, Paul. It stands for B-type natriuretic peptide. This measures stress on your heart. And if you have high stress on your heart, if that number on that test goes up, the solution to it is to simply supplement with higher doses of coenzyme Q10, which is a direct way to reduce your risk of heart disease and document that it's happening. I'm Dr. Todd Binkley, and you're listening to Safe, Effective, Natural Solutions to Almost Any Health Challenge. I promised I'm going to talk about an excellent case of a woman who came to me with fatigue today. But before I get into the specifics, I just, I ask yourself, or people that you know, have you noticed people that are having fatigue, feel tired all the time for no apparent reason, and then maybe they've been to the doctor already and have been told the tests are normal? Well, is that really true? Are your tests normal? Has your doctor even done all the tests necessary to identify the potential causes of fatigue? Well, short answer to that is no, because there's almost never a single cause of lack of energy or fatigue. It's almost always caused by a half a dozen or more, sometimes a dozen or more little things that are contributing to it. So why shouldn't you have all the energy you used to have? Well, a lot of people think, I eat right, I exercise, I drink plenty of coffee, my energy should be great. I guess I'll just have to get used to it. Well, in reality, lots of people eat really good food, fresh veggies, farm-raised chicken, wild-caught fish, go to the gym, drink good water, and still feel exhausted. So a lot of people also think, it's totally normal to not have all the energy I used to have. Everyone slows down as they get older. Well, that's not true either. In reality, most fatigue is caused by, as I just mentioned, several little things that can be measured on testing. So as an example, one of the most recent patients who came to me is having unexplained fatigue. She's doing everything right. She's eating pretty well. She looks great. She's exercising. She's happy. She's got a job she loves. She's busy, but she likes being busy. And for the last couple of years, her energy is like half of what it used to be. And there's no apparent reason for it, none that she can find anyway. And she had been to another doctor who told her that, all of her tests were normal. Well, when I tested her, number one, I do a lot more tests than most doctors do. And I identified a whole bunch of things that were contributing to her fatigue. She had borderline anemia from insufficient vitamin B12 and folic acid. Now, I didn't even determine this by measuring or testing directly for these vitamins. Often patients will come in and some of their doctors will have tested folate and B12 levels in the blood, but that's not actually the best way to do it. It's much better to look at a complete blood count, because when your body is deficient in folate and B12, your red blood cells get bigger. Red blood cells live for about 3 months, and if your bone marrow isn't getting sufficient folate and B12 to make adequate numbers of new red blood cells, according to demand, whatever demand you're putting on it, then the old red blood cells that are working their way through their lifespan get bigger to take up the slack. So that is a classic sign of deficiency of folate and B12. And then the other most common cause of anemia, which was part of the case in this patient as well, any menstruating woman who's not supplementing iron, especially if their flow is heavy, is going to be functionally iron deficient, even if they go to the doctor and they tell them that they're not anemic. Well, if they're losing blood and they're not replacing it, they're going to be functionally anemic, and it will show up when you look at the healthy ranges, the functional ranges, the ranges on standard blood tests, that not the broad ranges that are used to determine whether or not you need a medical procedure or a drug or some kind of medical follow-up or specialist that day, but the functional ranges to measure for normal human physiology, normal function. Any menstruating woman who's not supplementing iron to replace the iron she's losing in that blood is going to be functionally anemic. And a lot of women know this. This is the other thing I hear so many times, have heard so many times over the past 30 plus years in practice. Oh, I know that I need to take more iron, but I can't. It makes me constipated, or it gives me nausea or stomach upset. Well, the reason that's true is because 99.9% of folate and of iron supplements, 99.9% of iron supplements on the market are ferrous sulfate, iron sulfate, which really no one should take because it's just very difficult to absorb that, and it causes nausea and cramping and other issues. But that is not the only option. Iron the bisglycinate, 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 the bisglycinate form of iron, I've been giving to women for dozens of years, and I haven't had a single one who had any problems taking it. No constipation, no stomach upset, no nausea. So any woman can take iron supplements if they need it, if they take the right kind. The product I use is usually, that's not the only one available, but the one that I always have in my office is also made by Orthomolecular Products. It's called Reacted Iron. In addition to these two forms of mild anemia, this woman also had borderline low thyroid, another thing I see all the time, as well as a lower than normal white blood cell count. White blood cells are essential for fighting off and healing infections, and a lot of times you have a chronic infection in your gut, in your sinuses, or in your gums that you don't even know about. Well, you usually know about it if it's in your sinuses or your gums, but lots of people have too many bad bugs and not enough good bugs in their gut and do not know it, because it may not cause any symptoms at all except fatigue. So this can show up. The lowered white cell count will show up on the test, on the blood test panel that I do on everyone. And specific types of the white blood cells may also be lowered. And that shows that your immune system is being challenged. Well, not surprisingly, I also test vitamin D levels on every single patient, and most people who end up having that lowered white cell count also have low levels of vitamin D. Your immune system is dependent upon adequate levels of vitamin D. The standard dose for most adults for functional range to keep your immune system strong is 5,000 units of vitamin D a day. If you're a white woman who weighs less than 120 pounds, then 4,000 might be enough. But even children that weigh over 50 or 60 pounds, I often recommend they take 5,000 units of vitamin D a day to keep not just your bones, but your heart, your brain, and especially your immune system strong and functioning at its peak. So we identified, four. It's been iron and folate and B12 deficiency, iron deficiency, vitamin D deficiency, borderline low thyroid, and a chronic infection of some kind. We don't even know what the infection is, but just giving this woman some nutrients to build up her immune system, restore her vitamin D levels to where they should be, between 50 and 90 on the test. Your healthy levels of vitamin D on the standard test should be between 50 and 90, whereas most doctors will tell you you're fine if it's above 30. So we gave her some supplements to deal with these deficiencies, made sure that she was actually, not doing as much exercise as she used to do because of the fatigue. Hello, it's not easy to exercise when you don't have any energy. So after 4 months of taking some supplements, she started through, I forget what she said, it was halfway through or 3/4 of the way through, maybe a month, 2 or 3, she started exercising a lot more because she had the energy to do it. And that it makes everything work better. So she's happy, feeling good now, has all the energy to do the things that she wants to do. And she said, I feel like a new person. And I said at the top of the show that fatigue is one of the most common things people come to me for, and I've helped hundreds and hundreds of people identify what's causing their fatigue so that they can correct it and have healthy levels of energy without resorting to stimulants or other things that don't really give you energy. They just, they give you a false sense of energy without actually improving it, without improving your own body's ability to make its own energy normal, which is the way you want to do it. So if you know someone who has fatigue, please have them shoot me an email. You can even check out another website in addition to my regular website, BinkleyHealingCenter.com. I set up a separate website just for fatigue with information about fatigue called FatigueFreeLiving.com. FatigueFreeLiving.com is a great place to send people that who are having fatigue and want to know how I might address it and, understand better about why there's so much confusion, why so many people have it and don't know what's causing it. And there's a great example of a successful case there who had amazing results with what we did for her. And then there's even a place at the bottom where you can sign up to get some more information, a guide that I developed called The Dozen Most Commonly Overlooked Causes of Fatigue. Here's an interesting article in the medical literature. The headline is, the quote, useless appendix is more fascinating than we thought. And then further down in the article, the appendix is called a safe house for bacteria. Do you still have your appendix? It's sometimes important. It can be an emergency situation. If your appendix ruptures and can leak bad bacteria, causing a rapidly expanding infection. So there's lots of good reasons that people have had their appendix out. But there's also a lot of people that have had it just routinely taken out for no good reason at all. That's what the subject of this article is. For years, people who are having surgery for some other reason, while they've got you opened up, they would just take your appendix out while they're at it, thinking it's a useless organ that has no function and might save you from having to have another surgery later. So that's no longer considered best practice. But there's more data coming out that shows for years, there still hasn't been a convincing argument for what the appendix actually does. Well, so French researchers in a 2023 study compiled data from a French zoo that established that animals with appendixes are far less likely to suffer severe diarrhea, far less likely to have diarrhea in animals than those that don't have an appendix. So immunologist William Parker, PhD, a visiting scholar at the University of North Carolina at Chapel Hill, says, quote, these data are about as good as we could hope for in support of the idea that the appendix might protect mammals from gut problems. An experiment on humans would be unethical, but observational studies offer clues. So one such study showed that people with an intact appendix, when compared to young people who'd had their appendix removed, the people that had their appendix removed had double the risk of developing a serious infection of salmonella that would require hospitalization. So studies like this add weight to the theory that Parker and his colleagues developed back in 2007 that the appendix acts as a safe house for beneficial gut bacteria. We're hearing more about the importance of a healthy microbiome, of having sufficient amounts of good bacteria in your gut for a whole host of reasons. So Dr. Parker suggests that we think of the colon as a windpipe that may become contaminated with a pathogen, a bad bug such as salmonella. Well, diarrhea is going to follow so that the pipe gets repeatedly flushed, wiping everything clean, but also including your friendly gut microbiome. So luckily, you've got this little offshoot of the pipe where the flow can't really get in because it's too constricted. That is the appendix. The appendix is a little worm-shaped blind pouch that sticks off of the lower end of the small intestine right where it transitions to the large intestine. There is evidence to show that the appendix is full of beneficial bacteria, and it survives this flushing out. If you get diarrhea from eating some bad food, you don't wipe out all of your good bacteria after you've had diarrhea if you have an appendix, because it stores up some of the good bacteria and they can work their way back into the gut. So that's why they're calling it the safe house for beneficial bacteria. The appendix is also rich in special cells that they're called M cells, that act as scouts, detecting and capturing invasive bad bacteria and viruses and exposing them to the body's defense teams, such as T lymphocytes. There are several studies that show people who've had their appendix removed have increased risk of certain diseases. A study done in Taiwan showed that people who had an appendectomy had a 40% higher risk of developing irritable bowel syndrome. There was another study that showed that within 3 years of having their appendix out, patients under 30 had double the risk of developing type 2 diabetes. So don't panic if you've had your appendix out. It may just be a good reason to come in and get a functional medicine evaluation to identify whether or not you need some support. Perhaps you need a good probiotic or some good prebiotics to feed the healthy bacteria and grow more of your own. The test, sometimes a stool test is required. A stool test can directly measure whether or not you have adequate good bacteria and too many bad bacteria, whether they be, or bad viruses, parasites, or a fungal infection. I've had some cases of severe irritable bowel syndrome, severe ulcerative colitis, and Crohn's disease. People who have gone to other doctors on medications and just nothing has worked for years and years and years, and helped them make dramatic recoveries by testing for and restoring the normal beneficial microbiome in the gut. This is hugely important for those conditions, but also for any condition that involves a weak immune system. Almost any mood disorder, depression, anxiety, attention deficit disorder, hyperactivity, these things are all affected by your gut. So gut health is super important. It's one of the most important things to consider testing for. If you're not feeling right, I'd love the opportunity to help you or someone you love find out what's actually causing their problems that other doctors haven't been able to figure out and get you feeling better as soon as possible. Thank you for listening. I look forward to speaking with you right here next Friday at 4 p.m. Have a fantastic weekend.
You've been listening to Safe, Effective Natural Solutions with Dr. Todd Binkley. If you have a health question you want discussed on the show, email your health questions to Dr. Binkley at binkleyhealingcenter.com. Take advantage of this opportunity to ask questions for yourself and for your loved ones, because our health matters. Join him next Friday at 4 p.m. for safe, effective natural solutions right here on 98.3 The Word, KDAR.